So I see on the schedule that we have you here today for teeth cleaning. That's accurate? It's your 6 months, yeah. That's what I thought. Let me just sanitize my hands real quick here. Do you have any concerns about your teeth or your mouth? Anything like that? Okay. Well, if you should think of anything, just let me know, okay? Alright. So to get started, first I'm just going to take a look at the outside of your mouth. So I'd like to palpate along your jaw and down your neck. Just looking for any swelling or irregularities. Sometimes when something is going on in the mouth, it can present on the outside. So I just want to take a look, okay? Okay. Is it okay if I touch you? Thank you. Okay. So I'm just lightly placing my hands on either side. If you feel any kind of tenderness or discomfort, I want you to let me know, okay? Just feeling along your thyroid. Down the side of your neck. I don't feel anything out of the ordinary. You have good symmetry here of the jaw. So I am going to put a drape around you just to protect your clothing. Some people like to pick their clips. We have different colors to pick from here. So you can pick any color you'd like. They are all freshly sanitized, I promise. Orange? Okay. Sure. Put you guys back here. This and take this around you. So. want to make sure this is covering your shoulders. Okay. How does that feel? Is that okay? Okay, good. So then I'm just going to put on a mask. Okay. Alright. So then let's get you lying back, okay? Okay. So I'm just going to position my light just a little bit here. Okay. So, is that okay? It's not too much in your eyes? Okay. Let me know and I can reposition it for you, okay? Okay. And you're okay lying down like this? You're comfortable? Okay, good. Let me know if you need me to reposition you at all, okay? I'm happy to do that. Okay, so alright. I'm just gonna have you open up really big for me, okay? I'm just gonna be taking a look with my mirror, and if I see any buildup of tartar, then I'm gonna remove that for you, okay? Okay. So let me know if anything is really uncomfortable, and I'll back off and then examine the situation. Okay. So just open up for me. Good. Just looking at the upper teeth on the right. Got a little bit of tartar buildup on these rear molars, which is pretty common actually. It can be a bit more difficult to reach the brush. That's why we go get our teeth cleaned. So that way I can take care of these for you. Now I'm just looking at the upper left. Keep your mouth open for me. Perfect. ahead and relax your jaw for just a moment for me, okay? Okay. Look at the left, so open up again. Beautiful. So I am getting a little bleeding from the gums back here on the bottom. So in just a moment I'm going to examine you for signs of gingivitis so we can see how advanced. That way, in case there's any kind of periodontal disease forming, we can take care of that. Okay. Relax your jaw for just a second while I change out my instruments. All right. Just gonna place this guy in your mouth just to make sure that we absorb some of that blood. I'm just gonna place another one right on the bottom here on the other side. Okay. I'm just gonna rinse. These guys out of the way again. Okay. So let's have you open wide one more time. It's going to be measuring. Oops. It'd be helpful if I took this off. Okay. So I'm going to be measuring the amount of space or depth that my instrument is able to go here. pretty consistent twos. Relax your jaw for just a sec. Great. And open. Yep, same with the lingual side of the teeth. Relax for a sec. Okay. You doing okay? Okay. Okay, so now we're gonna do the bottom. So yeah. So to measure each tooth here. It's important because we want to make sure that we catch these things early enough to prevent any kind of, like, bone loss, for example. Just clean your mouth out one more time here, okay? So this is just going to spray. Go ahead and rest your jaw, okay? You are feeling some soreness. Which side? Okay. Do you feel a little bit of muscle tightness? Do you know if you grind your teeth while you sleep at all? Okay. Sometimes that can be a symptom. And if that is what's happening, we can get you a bite guard and have you fitted for one. Well, if that continues, So I want you to come in and let the dentist know, okay? So that way we can take some impressions of your teeth and get you fitted for a bite guard to help prevent any future grinding in your sleep, okay? Okay. So let me just finish my scaling here, okay? Okay, so open really wide for me. Perfect. Keep it open real wide for me. Don't have a whole lot more to do, here. Just want to reposition my light real quick here. it's not the easiest to keep your mouth open for this long. All right. Yep, keep it moving for just a second longer. You can relax. Open up again real quick. Just want to see how this bleeding is looking. Okay, gonna remove that. And on the other side here. Good. Okay. So, I'm gonna polish your teeth now, okay? Okay. Do you have any preference in terms of flavor of toothpaste? We have bubblegum, mint, or cinnamon. Mint. Sure. Okay. Mm-hmm. So I'm gonna have you open up wide for me again, okay? Okay. So I'm just gonna go right onto your teeth. Is that okay? Okay. If you need me to get a more gentle brush head, I can do that for you. Alright, going back in. You're doing great. We're almost done. take a quick look again with my mirror and make sure I got everything. Floss here, okay? Are you flossing every day? Okay. It's really important when you floss to make sure you slide down and really go against the side of the teeth. It's going to help prevent some of this future build-up here. Take a look. Okay. Nice and clean. And just do one more rinse. Okay. let's get you your fluoride treatment, okay? Okay, give me just a moment here. These are brand new. Just gonna spread this so it's even. This is going to fit onto your upper teeth. Okay, perfect. Get the layer. Fit this in on your lower. Okay. So I need that to sit on your teeth for just a few moments. So while it's doing that, I'm just going to take some notes, okay? Okay. And then over there. Okay, so let's remove these trays, okay? Okay. Open up really quick one more time. Sorry, just making sure that your teeth were completely coated, which it looks like. They were. Okay, good. So, okay. Let me just move my light out out of the way and then we'll get you sat back up, okay? Okay. Okay. You did great. So, because we just finished a fluoride treatment, it's really important that you refrain from eating anything for the next half hour or so, okay? Okay. We just want to make sure that that fluoride really absorbs onto your teeth. Okay. So I'm just going to take your bib off now, alright? So, garbage. And we'll put this in a pile to have it sanitized. Okay. Do you have any questions for me before I step out? Okay. Well, go ahead on your way out and stop at the front desk, and our scheduler will get you scheduled for your next teeth cleaning 6 months from now, okay? Of course, if you have any issues before then, give us a call and we'll get you in. Okay. Well, it's really great to see you today. I hope you have a great rest of your day, okay? Okay. Take care.